In the previous session, we discussed about what are the various things in psychological testing we use. Okay, in psychological test, actually here, when we said in research we are going to use this, so here we need to discuss about how we are going to do the interview process. See, first, whenever we are doing the psychological test, we need to check how the interview is going, how the clinical interview is happening, what kind of a questions do we need to ask the persons, and what are the various methods are we following when we are asking the persons. These are the things we need to focus. By means this completely focus on the how the person is interacting the other person, how he is getting the data from the person. Okay, these are the things in psychological test is very important. Actually here, whenever we are doing this, see, we'll call it as a psychological testing and even we'll call it as an interview method. Okay. Whenever we are doing this, we will talk to a person or a group or based upon the event or a situation, we will do the research. We will go ahead with the psychological testing. Actually, to explore this psychological phenomena, we need detailed holistic manner. We'll follow the detailed holistic manner. First, we will understand the what is that a qualitative observation or only focused on detailed observation? Okay, what kind of interviews are we going? Okay, here, whenever we are going with the interviews, is that in-depth exploration? See, for in-depth exploration, we'll follow one method. Okay, and what are the individual case studies? Suppose if you are focusing only on single individual case study, suppose you want to study a patient with a rare psychological condition. So here what we do, we completely focus on this material. We completely ask this kind of questions to the person, to the subject. Okay, whenever we are asking this kind of questions, we need to understand, okay, what is the process. Here, psychological testing is defined the process of administering, scoring, and interpreting psychological test. So, suppose without having any knowledge of questionnaire and what we are doing and what is the case study, we can't proceed further. So, here, whenever we are doing that, we need to have an answer. What kind of a group of people we are pointing out? And we need to see their behavior and traits. Example, suppose we are doing a research on a group of children with autism. So here, before in hand, we need to have the information. And before, see, it comes under clinical study whenever we are doing. Okay. So suppose we are doing the comparative studies. See, first we need to have an idea what kind of a study we are doing. Then we need to have what are the inputs we are, how to ask the questions, how to interview the person. So here the comparative case study. Suppose if you are going with the comparative case study, here whenever we are doing the comparative case study, we need to have two groups. Okay, we need to identify the patterns and contrast. Suppose you are comparing with the people with and without PTSD. PTSD means post-traumatic stress disorder. So here we need to have two groups comparing people. One, we need to identify with people and without people. So here we will see what are the symptoms they have, and we will, based on that, we will ask the questions. We need to prepare for the interview method. Okay, whenever we are doing this, we need to have an idea and we need to have the flexibility. Okay, what are the data and what are the things and how we are observing, how we are interviewing the person. Okay, suppose without having the proper interviewing method or interview, how we are doing the interview, we cannot. Okay, whenever we are following these questions and the interviewing methods and all, we need to maintain the confidentiality. That means personal information and identities must be protected. Okay, and here one more important thing. Researchers must minimize harm and distress to participants. See, suppose if the person is saying, I'm not interested to answer the question, then we have to say, thank you, have a nice day. Suppose someone said, I don't want to follow this. Okay, here we need to give that kind of a freedom to the person, participant. Okay, here we need to ensure the researcher perspective does not influence the result. See, suppose I am a researcher, I'm thinking everyone have a depression. Okay, so here the group belongs to highly depressed people. Or by seeing the person, okay, I'm thinking, oh, he's depressed, severe. So don't probe the kind of questions to him. You just understand. So don't be biased and don't be objective. Okay. And whenever we are doing case study or whenever we are getting into the research, whenever we are applying the psychological testing, we need to see what kind of a study we are doing, what are the pattern we are following. First, we need to understand the impact of the questionnaire and their behavior. So based on that, we need to ask those questions. Otherwise, what will happen? We can't get the data. We don't get the quality of the data. So we need to check all these things. So whenever we are asking, suppose we are asking students multiple choice, like midterm exams. Here they must read the various answers for each item and identify the best one. Suppose whatever the answer you are following, no, not required. They need to say the same thing. So here we need to ask, tell me about a time when you had a deal with an upset customer. What was the situation? What did you do? And what was the outcome? Like this, we need to participate. Suppose someone is attending an interview. So if you are giving only one option and one or two answers, sometimes we already discussed it. That won't come into the output. Output is not that. So whenever we are preparing the psychological test, it should be formalized of a mental functioning. And most are objective or quantifiable. See, whenever we are seeing the measurements, like we are applying the inventories, questionnaires, and scales, even the psychological tests are administered in a variety of settings. Like we can administer in the preschools, primary and secondary schools, colleges and universities, hospitals, outpatient healthcare settings, even inpatient also, even psychiatric setups, and social settings. So these are the places we will. And whenever we are interviewing the persons also, we can do that. Okay. Here we need to prepare in hand the format. This is very, very important. Suppose we are talking to a non-Telugu person, but you have given the Telugu questionnaire. So here, whenever we are setting the psychological testing, we need to understand is the person is educated or not educated. Whether person is familiar with the questionnaire, the psychological testing questionnaire or not. Okay. Suppose if you are conducting a test on an educated person, we do have non-verbal test. So we need to follow that. And whatever the formats we are giving, it should be reachable to the person, means the client or the patient. They need to understand, okay, whatever the personal attributes, we need to measure the individual personal attributes and the traits or characteristics of the person. They need to understand each and every person. Then only we can understand the human behavior. Suppose in the exam, we are giving a multiple choice. Okay. Actually, here what we are measuring, the knowledge of the particular subject, we are asking the question. Suppose if you are giving multiple choices, here they will understand the question, then they can tell you. Suppose if you are giving a job, so here we need to give four options. How you are doing with the job? Okay, is that going to be successful? Or are you looking for the things like in a prompt way? So here all the options we need to give if the person is searching for the job. Even whenever the psychological testing we are conducting, we will see the personal attribute of the person and even the person's trait. What are the traits he is having and what are the characteristics to predict an outcome. Okay, all these things we will consider. And not only that, the personality and even the cognitive abilities. What are the abilities the person is having? So all these things we will consider, then only we'll conduct the psychological testing. These are the outputs of the psychological testing. See, why is this psychological testing is very, very important? Why is the playing a role? Okay, by conducting the testing, by seeing the person's mental abilities and neurological function, even the personality, and what kind of a achievement and what kind of a ability the person is having. Okay, so here, after measuring this, we even see their intelligence capacity. What is the school they can go for, and what are the courses they can? What is their learning disability? Okay, is there any developmental delay with the person? And we can even identify giftedness, or we even see the tracking of intellectual development. See, if the person is, we come to know that if the child is a gifted child, so he is not supposed to go with the same school. So here they need to have a special care and special needs. Their needs are different from others. So when we are addressing the child, we can encourage the parents to join in the special school. So here what's happening? We are guiding the person in a prompt manner. Otherwise, what happened? He will join in the same school, but he is unable to cope up with the things. So the child will face the problems, even parents also face the same problem. So after diagnosing, by seeing the psychopathology of the person, we need to identify what kind of a personality disorder the person having. What are the depressive disorders? So here we need to address and we need to support the person. What kind of a vocational course he need required? Suppose if the person is challenging person. So all these things, this is the importance of the psychological testing. So without doing this, suppose if you are sending the kid to the regular school, if the person is suffering with autism, so what will happen? He cannot cope up with the students, and people may bully the person. All these things may happen. So here we will understand the person's personality strengths and even weakness also. So we will guide them in an educational setting. So all these things are very important whenever we are going for the psychological testing. These are the output of the psychological testing. And not only that, whenever we are going for the psychological testing, when we are planning for the counseling selection, placement, and even suppose if the person is into a civil service, what kind of the characteristics he needs to develop. In all the sectors we use, even medical clinics, in industries, when we are recruiting people, and all these areas. And the psychological test results are individual destiny in many ways. Okay, here we need to understand if the person is depressed or not, if the person is having anxiety or not. All the things also we can understand by seeing the importance of by conducting the psychological testing. So here, whatever the reasons people are going with the issues, we can acknowledge and we can put them into the mental health therapies. Next, meaning and definitions of psychological testing. What is a psychological test? It's one of the source of data using it in the process of assessment. Okay. Actually, here, whenever we are doing the test, we need to have the checklist. What are the things we are assessing? What are the traits the person is carrying? What are the symptoms the person is carrying? So all these things we need to see. And even the psychological assessment is more of a complex. And not only that, we can even understand the detailed in depth of the person. And based on that only, we can provide a diagnosis for treatment settings. See, suppose if the person is suffering with aggressiveness, more, we understand by conducting the psychological test. So here what we'll do, this person is having a lot of anger issues. So here, if he is meeting a psychiatrist, based on this diagnosis, he will give the medication. If the person is into suffering with autism, same thing. The psychiatrist will help. Not only that, suppose if the person is completely ID or schizophrenia, so here we can help even the courts also. Okay, courts also decide some issues such as a child custody or competency, or yeah, if the child is getting some mental ID issues, intellectual disability issues, they may get some government pension also. Okay, so here these are the use of the psychological testing. So here psychological tests are written, visual or verbal evaluations administered to assess the cognitive and emotional functioning of children and even adults. Suppose if you're not doing, if the people are challenged people, they will get some kind of reservation from the government and they do get some benefits from the government. All these things they won't get the privilege. And here, whenever people are joining in the same schools, they are unable to cope up with the other kids. So they lost the balance. So at least they need to understand their special needs, then they will be joined with the special needs school. Okay. Mr. Robert Gillian, 1998, he defined the term as an objective and standardized procedure for measuring a psychological construct using a sample of a behavior. Okay, here, why this psychological test? Actually, here, whenever we are doing the psychological testing, we will understand the person's knowledge and the skills and abilities and other characteristics. So this is called by KSAO. So that it's a short form of that. So whenever we are doing the psychological testing, we can, by reading the questionnaire, the person can understand and he can observe and yeah, he can go with the answer. After seeing that, we can understand what are the performance and what is the validity, and not only that, what is the reliability of. See, validity means there is an evidence to support the specified interpretation of the test results. Yesterday only we discussed in the class. So, what is validity? It plays a role, even the reliability also. That means we are conducting the test based on the evidence based. Because of that only we are conducting this. So, for evidence based, we need to have the strong evidence whenever we are conducting the test. So here, for all the psychological tests, reliability and validity is there. Okay? Reliability means only interpretation and testing results support, evidence support. Okay. Internally consistent or giving consistent results over time across methods. That is called reliability. Suppose we are asking some questions. Okay, we will even see the consistent results. Okay, and not only that, what are the other results we even see? So here, if the test is not having reliability and validity, then we don't consider. So we need to check all these things. And even it includes the use of standardized instruments for the purpose of the diagnosis and treatment of and emotional disorders and disabilities. Okay, now we are going to discuss about the characteristics of psychological test. Actually, Anastasian in 1982, he mentioned objective and standardized measures of a sample of a behavior of an individual. He said, actually, whenever we are conducting the test, we need to have objectivity and standardization in this context. That means whenever we are observing, administering we need to do the scoring and interpretation of the test. It follows the uniform and standard manner. Suppose if we are using the 16 IQ test, okay, here what the person will do, we will understand. First, before administering the questionnaire, we need to understand and we need to give the material to all the subjects. They need to follow the language of the questionnaire. Okay, then only we need to we interpret the scoring depends upon the scoring key, depends upon the manual of the psychological testing. So here all the manuals, so that the procedure, all the manuals will follow the strict rules. Okay, then only we can use that psychological testing in our this thing, in our assessment. Then only we will consider that scale. means that questionnaire is reliable. Okay. Here, the application of the test and its interpretation do not involve the examiner subject to judgment. We already discussed that. Here, whatever you are expecting, sometimes your hypothesis may be wrong. That means whatever your expectation, it may turn into wrong. So here, whatever the subject, whatever the examiner's subjective judgment is not at all valid. Okay, we'll consider only the participant questionnaire and his answers, his judgment only. Okay, so here the test measured by ultimately the behavior. Okay, here what are the things is involving? Okay, in the behavior. Behavior means feelings, motives, interest, and the other aspects of a mental functioning. So here, whenever we are seeing the main characteristics of the good psychological test, first thing, see, we need to require few things. One is objectivity. Okay, whenever we are prescribing or we are going with this one psychological test, first thing we need to check what is our objectivity. Is the questionnaire is matching with my objectivity or not? Okay, the test should be free from subjective judgment regarding the ability, skill, knowledge, trait, or potentiality to be measured and evaluated. So here we need to see the objectivity of the test. Then we need to go with the standardization. All good psychological tests include behavior samples that are obtained under standardized condition. See, if the test is not standardized, you cannot consider into the evidence based. Okay, suppose what are the factors related to the environment? Suppose we are conducting the test. So here, what are the characters we need if you are conducting an environment like room temperature, lighting, all these things. Or example, like see, even the examiner attitude also is required. How he's giving instructions. Suppose if the person, the examining, how, for example, examiner attitude, how the instructions are good or bad, even the examinee, for example, disease or fatigue. Suppose if the person is, the examinee is suffering with some disease or some high temperature or some other issue, how can he able to answer? So all these things we need to consider. So here, everyone tested under the same condition. Whenever we are taking the sample, we need to check the environment. Suppose if you are giving a questionnaire, some next place, some noise is happening. He's getting disturbed. So here, whenever we are conducting the test, it should be in a quiet environment. And language he must and should can reach, can readable, can understandable. Okay. So here, with, whenever we are conducting the test, we need to see all the things. We need to consider. So here, whenever we are doing the test developers have also little control over what test takes to the night before they take the test. See, suppose if the person is not having any kind of idea, how can, so that's the reason we need to follow the standardization. These are the standardized conditions whenever we are conducting the test. So here everyone needs to follow the standardization. Then we'll go back to the reliability. What is reliability? Actually, this is refers whatever the results we are obtaining, it should have consistent or reliable. Okay. Why? Suppose if there is no consistent results not there, what happens? It's like a the test won't applicable. So here we need to see the relatable gap of time. At the same time, reliable test will yield same scores. See, one person may get high score, the other person may get low score. Okay, it means the test is trustworthy. Uh, it won't applicable. So everyone should get the same kind of a scores. Okay, something relatability is there. Otherwise, what we'll say, the test is not trustworthy. Okay, so here all the methods we need to consider whenever we are doing the reliability of the test. Okay, here whenever we are checking the reliability, we need to see obtained results are consistent and reliable. If they are not consistent, if they are reliable, the test is considered as not trustworthy. I mean, the person might be not interested to go through the questionnaires. He's not interested to read an answer, or else the person is giving all the answers same. Okay, suppose he answered only A, something like that. See here, we need to check all the things. We need to consider all the things into that whenever we are going with that. So, yeah, next, validity. It refers to extent to which the test measures what it tends to measure. Suppose intelligent test is developed to assess the level of intelligence. Okay, here this test needs to assess the intelligence of the person, not other factors like what kind of emotion he's carrying, how the anger, okay, how he's behaving with others, what is his personality traits. No. So whenever we are seeing the test, whenever we are seeing the psychometric test, whenever we are preferring one psychological test, we need to see what is the validity. So here, if we are pick the test of psychology intelligence test, the questionnaire should contain only the intelligence related questions. If it contains other questions, the questionnaire, the test is not valid. Okay. So these are the things before checking into the, before observing the, before taking the questionnaire or before conducting the questionnaire, we need to follow. Next, norms. Norms refer to the average performance of a representative sample and a given test. Okay, here, whenever we are seeing the text, okay, here we will see the picture of average standard of a particular sample in a particular aspect. Here, what are the norms and standard scores developed by the person who develops the test? Okay, see, whenever the person is developing the test, he needs to follow the certain norms. Okay, whenever we are comparing their scores with norms, actually, then we need to get the level of the our sample. Okay, same kind of norms. So here, whenever the person is preparing, they will focus on the norms also. Means if norms, they're not satisfied, they need to develop those norms. If it's not satisfied, then we can't call it as a standardized test. Practicability. The test practicability in time required for completion, the length, number of items, questions or scoring. Actually, suppose if you are giving too lengthy questions and you are giving less time, then also practically it's not possible. That's the reason we need to see what is the length and how to answer and is that difficult or not. So all these things we will need to consider whenever we are picking some test. Okay, whenever we are conducting the test also, we need to see the standardized conditions. Okay, suppose you are conducting the test on 10th class people, but the questionnaire contains like a degree standard or above the standard. So here we are not supposed to conduct. So we need to see what are the practical applicable things to conduct the test. So here we need to understand the practicality of the rules for scoring. See, suppose the examiner is there, okay, but he doesn't know how to do maths. Okay, suppose he conducted a maths questionnaire on them. So how is that applicable? So here we need to see if he know the scoring of the particular test or not. Okay, he needs to whether he is able to follow the generalized guidelines or not. So all the things we need to consider. Okay. So for example, if item 1 mark 2 and then delete to 2 points, then see what will happen here. The scoring skills the examiner needs to understand. Then only he can give you the particular scoring. Otherwise, he not. He can't. Okay. Now we'll discuss about the types of psychological test. Okay. Whenever we are discussing about the psychological types, okay, psychologist talks about a person. We'll discuss about the present functions and functioning. Okay. Here, actually, whenever we are seeing that test, first, we need to see how to get into the psychological testing. First thing, four. One is, the first one is clinical interview. Okay, clinical interview, we will use, okay, first clinical interview. Second one is assessment of intellectual functioning and personality assessment. The fourth one is behavioral assessment. These are the areas most of the time we will conduct the test. We'll conduct the psychological assessments. Okay, here most of the time aptitude and achievement test will conduct for the schools. Even it might be career or work counseling. Okay, and even management skills also. And whenever the people are planning for career, even for that also we'll conduct the test. Even the personality assessment. Suppose if you are recruiting in an organization, what kind of a personality? See, if the person is having less communication skills, if you are posting the person as a front office executive, or if you are taking the person into marketing, how can he able to survive and how can he give good results to the organization? So suppose if he wants to take a MBA into marketing, but the person is completely introvert or unable to speak and he have no voice. So whenever we are conducting the test, we need to understand their personality and we need to guide them. So in career counseling, we need to see the behavioral assessments also. It's required. Suppose if the person is completely introvert, he can't even say whatever his feelings. Then if you're recruiting the person as a, what do you say, manager or some leadership, so how can he survive? So that's the reason we need to check what are the things we are. Now we are going to discuss about the clinical interview. In the clinical interview, actually, whenever we are doing, okay, here first we need to understand what are the things we are doing in clinical interview. So it may take more than 1 or 2 months, 2 hours in length. And most of the time, clinicians they do in their office, like professional way. Okay, psychologists and psychiatrists, even the clinical social workers, even the psychiatric nurses, they do the clinical interview. Okay, clinical interview, we need to have the special training and they need to have the special license to do the clinical interview. Why means, see here, clinical interview, whenever they are doing in a professional setup, they will get the, gather the important background and family data about the person. Okay, here they will gather a lot of information in the gathering sessions. It's most of the time will benefit to the client. Suppose if the client is unable to give the data, they will procure the information even from the attendees. Okay, here you may have to recall or review a lot of life and personal history with the professionals. One means in clinical interview, the personal history is very important. Okay, they may ask you many questions. They may ask you specific questions also, and the various stages of your life. Suppose if the person is suffering something, they may ask you about your childhood. How was your childhood? What are the things happening at your friend? So all these things, and not only that, they will get the basic demographic information. What is the family size and what is the history of a psychiatric illness, any one from the family. Okay, in clinical interview, all these things are required. And not only that, is there any developmental delay? Okay, if the baby born, what is the weight of the person? Is that a full-term baby or not? See, all these things they will ask you in the clinical interview. Then only they can come to a diagnostic information. By knowing all the things only, they can prefer what are the questionnaires, what are the psychological testings they have to do. This is completely into the professional setup. Next, assessment of intellectual functioning. Whenever we are seeing the person's IQ means intellectual quotient. Here we need to mention the general intelligence. Okay, it is important to know that IQ tests do not measure actual intelligence. Okay, here we measure what we believe might be important components of intelligence. See what are the things is required for intellectual functions, and that only intellectual test measures. Even neurological assessment also, it's one and the same. Okay. Means it's a different, but it's the same kind of a assessment. Whatever the questions is needed for the neurological assessment, they will probe only those questions. Of course, we already discussed what are the intelligence skills we have in a situation right now, like Stanford Binet and Wechsler skills. And here, the neurological assessments may take 2 days to administer also. See, sometimes what will happen after asking 20, 30 minutes or 1 hour person, they are not supposed to. They will say, oh, I'm done. I can't answer you. So here, by doing the test, we can understand the cognitive strengths and even the deficits of the person by conducting the test. Even the neuropsychological assessment is most of the time we will use who have suffered some sort of brain damage or any dysfunction, okay, or any organic brain problem. Even because of the old age, they may get other issues. Or is there any, if the person is having the brain hemorrhage, all the, all these possibilities, we will use that neurotransmitter questioning. Okay, most of the time we will use the Wechsler Adult Intelligence Test, fourth edition, to see the individual age 16 and older to take. Okay, and we do have the Wechsler Intelligence for children also. Okay, and once we divided into four major scales of arrive, what is called full scale IQ. Actually, whenever we are conducting the Wechsler Adult Intelligence Scale, okay, we will see what are the mandatory things. Okay, we focus on that. So here, this supplement subtle provides valuable information like what are things we'll get similarities, verbal comprehension scale, similarities and vocabulary, information, supplemental subsets, and comprehension. Okay, what is the perpetual reasoning scale, block design, matrix reasoning, visual puzzles? See, these are the subtypes of the scale, matrix reasoning and visual puzzles and supplemental subtest. And even the picture comprehension test. Actually, in picture comprehension test, they will give you three figures. Okay, we need to complete the whole story with that picture. And even weight measures. So they will give you 16 to 69 lbs weight, small, like this kind of things. So we need to, the person needs to weigh the things and he needs to say what is there. Even block design also, we'll place some blocks, they need to arrange in the basket. So these are all comes under perpetual reasoning scale in SS scale and working memory scale. Actually, here we will conduct the digit span test. We'll show some digits within the span of movement. They need to they need to calculate what are the digits they have seen. Even the arithmetic also same way. And supplemental subjects, letters, numbers. Actually, here processing speed scale. Here the symbols research. Okay, actually in this we will ask the person to what are the symbols are there. He needs to search even the coding also and cancellation. Actually here this is a subtest even 16 to 69 it will be there. So he within the what is the time limit how he is cancelling. Is he able to address the same figure or different thing? So we will see all these things. Now we are going to discuss about the personality assessment. In the personality test and inventories to evaluate the thoughts, emotions, attitudes, and behavioral traits, it comprises the personality. What are the behavior traits and what are the emotions we have? What are the attitudes we have? Okay, all these things we will assess in the personality assessment. By seeing this, we can understand the person's, even the child, personality strength and weakness, and where we need to identify disturbances in the personality. Or we can call it as a psychopathology. So once we know the person's psychopathology, we can understand how to deal and how to improve their coping skills. And what are the behavior things we need to change. So all these things will come. Okay. And here Minnesota multiphasic personality inventory, MMPI, 16PF, Title 16PF test. It is measures the 16 personality factors and Million Clinical Multi Inventory, MCMI. Okay, it also measures the personality test and projective test. We will discuss in the last class. It's called Rorschach Field test and thematic apperception test and Roy person test. Here they will, by seeing the drawing, they'll say something. By seeing the picture, they're from the story. So here, what are the objective tests? Actually, here in a personality test, we do have MMPA2 and 567 true false test. That is a good measure of dysfunction within the personality. Okay, here the healthy or positive personality traits. Actually, whenever we are seeing this, we can understand whenever we are taking the professional help in a psychiatric diagnostic label that suits the individual. Okay, here originally it's developed in 1940s. Okay, it's a revised version. Now we are using the MMPA2 and it measures the personality traits such as paranoia, hypomania, social intervention, and masculinity, like femininity and masculinity. Okay, by seeing the psychopathology and after conducting the test, we can understand. By seeing the psychopathology of the person, yes, we can see what are the things. Okay, even the questions are not always obviously related to the trait to which they correlate. Sometimes it might be a fake. So here we need to understand is the questions are applicable to the person or not. Okay, next one, the Millian MCMI is specifically used to arrive at a DSM-4 personality disorder diagnosis. Actually, here the test MMPI2 takes most of the time in by checking, by measuring, or by assessing the individual personality disorders is needed. MMMP2 is not an ideal measure for people with healthy personalities. See, if the personality is different, is suffering with something, if you got that kind of doubts, then only we'll go with the MMPI2. Even 16PF is more appropriate. In 16PF measures the traits of the person, what kind of a person he is, how to understand. All the traits of the person it reveals. Okay, then we can understand by conducting the test, we can understand them, and we even think about our approaches or strategies to employ in the treatment of best help to the person. Projective test. Projective test we already discussed. It's a Rorschach Inkbolt test. It's completely colorful. Okay, here we have two methods. One is the Rorschach and the other one is Exner system. Actually, these are developed in 1970s. Responses are scored based the location described. Actually, here we will show some picture. We'll ask the person how you are seeing from where, which angle. So we'll ask the person in the picture. What are the determinants are you saying about this? What are the responses by seeing the responses and what is more right for others? See, test. He needs to describe whatever seeing it. Okay, suppose if he says something, I'm seeing some bad, where exactly he's seeing? What are the determinants? So all these things we will mark it and we will the score. The next one, the thematic perception test, actually comprises of 31 parts. The deficit people in variety of situations. A few contain only objects and one card is completely blank. See, after telling all the card story, then they will reveal about their story. Actually, most of these card stories, they are the heroes or whatever the characters are they are seeing in their life. Okay, they will post their names in the stories, else they will involve them in that. The fourth one is very important, behavioral assessment. In behavioral assessment is the process of observing or measuring a person's actual behavior. In behavioral assessment, we can understand the person's behavior and even the professional values, and we can track his behaviors and we can help them to change. So if the person behavior is not good, suppose we have a lot of narcissistic traits, we can understand them and we can make them to we can understand in a natural setting observation. At the same time, by conducting the test, we can understand, okay, how the person is behaving with the person. Suppose you arrange a nanny for a kid. By spending nanny one day with the person, we can understand the person's behavior and we can understand what are the reinforcements he is doing, and we can understand what are the reinforcements we need to apply with the kid. Okay, so self-monitoring is also a component of a behavioral observation. Okay, not only the rest, by understanding behavior of the person also we can. Okay, all those things are here. Next, conditions affecting the test administration. What are the conditions is affecting? First thing, whenever we are conducting the test, we need to see what are the things we have and is that adaptive or in linear fashion, or if the person is having a computer knowledge, or individual, if you are administrating individual, if the person is having the adaptive the test, or otherwise we have to use the test takers performance. We have to consider. And yeah, we need to see what it's are we conducting the keyboard or a paper pencil test. Whenever we are giving the going with the paper pencil test, we need to give eraser. We need to tell them if you want to change the answer, you can change in within the certain time. And even we need to check what are the disabilities they have, individual motor disabilities. If the person is unable to read and write, then we are not supposed to give the paper pencil test, or else we need to give some help, some assistant. Even the groups, whenever we are administer the test, we need to see the group situation also. All the things we need to consider whenever we are conducting the test. Otherwise, what will happen? We are not supposed to conduct the perfect test. So here we need to understand first achievement, next intelligence, and what are the objectives of the test, and what are the personality tests we have, and where to conduct the projective test and how to conduct. First, we need to understand what are the standardized tests. So these are all about the psychological testing. Next session, we are going to discuss about the text construction. Okay. Chalo then. Bye. Thank you. Have a nice day.